Okay, good morning, everyone. Thank you for joining our media availability today. My name is Jonathan Modi. I'm the Public Information Officer in the Health Information Center for Oregon's COVID-19 response. I am joined by Dr. Becca Pierce, Healthcare Associated Infections Program Manager at the Oregon Health Authority, who's here to answer questions about our long-term care facility vaccination report published today. Just some reminders, this is a call for media partners. Members of the public are certainly welcome to listen in, but we are reserving this time for the media. We offer the public time for updates during our regular Facebook live events. For this media availability, we just ask reporters to please sign in with your name and the media outlet that you are representing. And to get into the question queue, please send a chat message using the Zoom chat feature. And when it is your turn to ask a question, the moderator, me, will call your name and the host and will unmute you. Also, if you want to record, you can message the host and the host will give you permission to record. And we ask that you pose one question at a time due to our limited time, but if you have any follow-up questions, you can certainly email the COVID media mailbox, which is orcovid19.media@dhsoha.state.or.us. And if you have any follow-up questions, you can get back into the queue and we'll try to get through as many of them as possible. So with that, I will turn it over to Dr. Pierce.
Thank you, Jonathan. Good morning, everyone. As Jonathan mentioned, my name is Dr. Rebecca Pierce. I'm an epidemiologist and manager of the Healthcare Associated Infections Program at Oregon Health Authority. Our interim long-term care facilities COVID-19 vaccination report summarizes vaccination data reported voluntarily by 62% of our Oregon long-term care facilities. As of early May, 84% of residents in reporting long-term care facilities have been completely vaccinated against COVID-19, meeting our state vaccination goal of 75% in these settings. 62% of long-term care facility staff have been completely vaccinated. A bit of additional context, we observed some geographical variation in these findings with lower vaccination percentages in Southern and Eastern Oregon. We also provided a bit of context about facility types. So, for example, we saw higher vaccination percentages in residents in residential care and assisted living facilities as opposed to nursing facilities, which may be reflective of a longer residency in these settings. 91% of residents in facilities that report a memory care endorsement to their license have been completely vaccinated. And vaccination percentages remained fairly constant since late March. I'll stop there with that brief intro and I'm happy to take questions.
Okay, thanks, Dr. Pierce. Again, if you have a question, to get into the question queue, please send a chat message using the Zoom chat feature. And when it's your turn to ask a question, I'll call your name and the host will unmute you. I don't see any questions in the queue at the moment, so we'll just wait a moment and see if there are any questions coming in. So again, if you want to ask a question, just submit it to the Zoom chat feature. And also just wanted to, again, note that if you have any follow-up questions, you can submit them to the orcovid19.media at dhsoha.state.or.us mailbox, and we'll follow up. Also, we will work to provide a YouTube recording of this media availability. So if you have questions, go ahead and submit, and we'll just hang tight and see if there are any follow-ups. This is we have a question from Lucia. Lucia, I'm not sure what media outlet you're with, but
Sorry, I've had the perpetual problem, and now my name is misspelled in the chat, but this is Rachel Monahan.
Oh, hey, Rachel, go ahead.
I didn't catch that this morning, that I was still named as my daughter. Okay, so what can you tell us about I haven't had a chance to go through the full report yet. What can you tell us about where there are still outbreaks at facilities and what's happening with vaccinations at those facilities?
Sure. So, for details about, the number of outbreaks and where they're occurring, I'll refer to our OHA weekly outbreak report. But what I will say is that, both nationally and in Oregon, we've really seen across the board decreases in COVID-19 outbreaks, cases, and deaths in long-term care settings. There's been tremendous progress since the vaccines were introduced. However, we need to continue efforts to make sure these high resident vaccination levels stay high and that we're continuing to see improvements in staff vaccination levels. So we're continuing to reduce introductions, prevent outbreaks, and prevent spread in these vulnerable settings.
So can you tell me, and I'm aware that with vaccinations, particularly the outbreaks in these settings have declined quite significantly, but what have you identified about what's happening with vaccinations at the facilities that have outbreaks? Is it breakthrough cases that you're seeing? Is there communities of people who are reluctant to get vaccines? Is it providers who are not providing the vaccines to these vulnerable communities? What can you tell me about that?
Yeah, thanks. I don't think this is unique to Oregon, but certainly in facilities where there are lower vaccination rates, there's increased risk of having an outbreak. We need to get these vaccination rates up absolutely as high as we can to prevent those introduction events. I think what we have been seeing, again, sort of across the board, is because we have so many residents vaccinated in these settings, there is so much more protection. We are seeing, less cases, less deaths among residents. But unless we get vaccination rates up high in staff, we will continue to see introduction events, which could lead to spread in these settings. So it's all about kind of maintenance and keeping those vaccination levels high over time to prevent outbreaks as we go forward.
Thanks, Rachel. Thanks, Dr. Pierce. Next question is from Claire Withicum with Statesman Journal. Go ahead, Claire.
Hi, thank you for your time, Dr. Pierce. I had two questions, if that's okay. It sounded like the reporting of the vaccination data was voluntary. And so I was curious, is there any plan to require facilities to report that data?
Yeah, thanks, Claire. So this data was collected during a phase-up period of our surveillance system for vaccination in long-term care facilities. Since this data was collected and analyzed, that reporting of vaccination data has become required both by Oregon Department of Human Services as well as the Centers for Medicare and Medicaid Services. So we are moving into a required reporting period at this point.
Okay, and when did that requirement begin?
So June 1st for Oregon Department of Human Services and June 14th for Centers for Medicare and Medicaid Services.
Okay, thank you. And so then I'm curious, I imagine given that from now on, you'll have a broader picture of what vaccine uptake is like in these facilities. But I'm curious, kind of given the data that you have now, do you have any projections or kind of any sense of what vaccination is like in these other facilities that didn't share that information?
Yeah, no, great question. And I think as we go forward and again, kind of shift more deeply into the required reporting phase, we're going to be collecting this information on an ongoing basis. So I think what we're keeping our eye on is trends over time and being able to ensure we're seeing appropriate maintenance and continued improvements in vaccination levels in residents and staff. We do plan to continue to release additional publications that provide more granular data and context about what's happening in different regions at the facility level as we move into this required reporting phase.
Thanks, Claire. Next question is from Ben Botkin with Lund Report. Go ahead, Ben.
Yes, I was hoping you could speak a little bit to the geographical variations. Do you see a correlation between that and vaccine hesitancy, and what role is vaccine hesitancy playing, in your opinion, in those lower rates? Thank you.
Thanks. There was no direct association made between levels of vaccine hesitancy or confidence and the geographical variation we observed. I think that is a question on everyone's mind right now. I think some of the geographical variation we see, not just in Oregon, but really throughout the country, really kind of emphasizes the no one size fit all approach to addressing vaccine confidence in healthcare settings. I think that there has been some research on this topic. Of course, this is kind of where everyone is focused right now. And I think what's sort of interesting is that what we see in healthcare settings for healthcare workers in particular are really the same types of concerns that we see in the general public. So individuals being concerned about vaccine side effects and potentially having to miss work. The idea that these vaccines are new and maybe they weren't tested sufficiently. And of course, on that last point, we focus a lot on the FDA authorization process and the fact that these vaccines have really been through rigorous testing, clinical trials of tens of thousands of individuals, and really trying to focus in on the work that has been done to continue to monitor safety of these vaccines. The bottom line is that these are safe and effective vaccines and can protect our healthcare workforce and prevent spread in these settings, but we have to continue to get that message out there.
Thanks, Ben. Next question is from Lisa Balick with Coin TV. Go ahead, Lisa.
Good morning. I'm trying to find out what's the plan to increase the rates among caregivers and staff, and is there any plan to make it mandatory in long-term care facilities?
Thanks for that question. I think just from a qualitative perspective, the key elements really remain ensuring access to vaccine. Staff and residents in long-term care facilities should be able to have quick and convenient access to the vaccines. I think second is ensuring access to reliable information from trusted sources. Conversations about vaccine confidence are ones we need to keep going. We continue to work with facilities to make sure they have vaccine maintenance plans. This is so important because although we're giving a snapshot of where these facilities are in terms of their vaccination status, these are not static populations. So residents are coming and going, new staff are entering the building. So it really is so important to be able to bridge from those first vaccine clinics that were being offered all the way through on an ongoing basis to make sure access remains high. I won't speak to the enormous amount of ongoing collaborations between facilities, state and local officials, pharmacies, community and industry partners. But this really is a shared credit and effort between all of those stakeholders. And continued progress is really going to depend on continued effective collaboration between all of these groups.
Thanks, Lisa. We have a follow-up question from Rachel Monahan with the Willamette Week. Go ahead, Rachel.
So is the state going to recommend making vaccinations mandatory for staff at these facilities?
Yeah, so no immediate plans to that effect currently. OHA supports efforts to maximize vaccination in accordance with Oregon law. So we recognize there are lots of differing views about how to do this. OHA does not recommend one solution in particular, but emphasize that different settings need to consider their settings, their own challenges, what's going on in those communities to maximize and encourage vaccine. I think vaccine incentives are going to remain a major topic of conversation, as is effective public messaging about the effectiveness and safety of these vaccines for our workforce and for long-term care facility residents.
Thanks, Rachel. Next question is from Wright Gazaway with KATU. Go ahead, Wright.
Thank you so much. I got in a little late, so my apologies if this has been discussed. The press release reads very optimistic, but 62% is low. I believe it puts Oregon in the bottom half. Given the outsized impact of the pandemic on nursing homes residents, how many have died and been infected. Are you disappointed that so many people appear to not be vaccinated among people who work in these facilities?
Thanks. Of course, the goal is always continued improvement and to get those vaccination levels as high as possible. We know the higher they are, the less likely we're going to see introductions and outbreaks in these settings. I think the tone remains optimistic because in early December of 2020, we were at 0% of vaccination rate. And, now we have 84% of residents in these reporting facilities that are vaccinated and 62% of long-term care facility staff. So tremendous progress has been made. But I think in order to sustain the reductions that we're seeing in outbreaks, cases, and deaths in this setting, it is absolutely true that continued effort is needed to make sure those resident vaccination levels remain high and that we continue to see progress in those staff vaccination levels. Our first goal that we've set just internally is that we want to see a 75% vaccination rate across the board, so for staff and residents. And I think we need to continue to see progress to that effect.
You have a follow-up question, right?
Yeah, I do. So are these staff members continuing to get vaccinated or has it basically stopped? I mean, the vaccines have been available to them for about 6 months now.
Yeah, so the vaccination levels that we saw in the report, so the period we looked at was from March through the beginning of May, and we saw vaccination levels remain fairly constant. I would note, though, that there was a tremendous amount of effort to ensure access to vaccine clinics early when vaccines first became available in these settings. And because we do have staff coming and going in these facilities, the fact that those levels have remained fairly constant does suggest that there has been a lot of bridging and vaccine maintenance happening in these settings. But, we need to continue to see some uptrends among long-term care facilities staff for sure.
Thanks, Wright. We have another follow-up question from Rachel Monahan with Willamette Week. Go ahead, Rachel.
So how often do you plan to make public the data that you're going to get on vaccine rates?
Yeah, so no definitive interval to date, but what I can say is we know this is information that long-term care facilities need, that our partners need, and that consumers need to evaluate how vaccination progress is going in these settings. So we are committed to making sure that information gets out there and that it gets out there on a regular basis. We're still finalizing the way to do that, but it will be on a time-updated basis.
Do you have a sense of how soon you'll release this data for the first time?
We're hoping as soon as possible. I can't give a firm date on that, but efforts to publish this data are already underway.
And do you have any information on places that have been successful in getting staff vaccinated, of what has worked there? For a certain segment of the population, it's about benefits, no? Like, are facilities offering the necessary time off to staff?
Yeah, I think that's a really important question for a couple of reasons, but I do think we're going to continue to be learning from some of our really high performers in these settings in terms of what they've done, or incentives, or leave policies that promote vaccination. So I think there's more to learn there and more to share between facilities. A lot of our efforts are making sure that that line of communication is open between state and local entities and the facilities themselves. They are really folks on the ground that know what's happening, know what works. So it's so important that those collaborations continue. Just as a general matter on the staff vaccination issue, I think it's so important that we continue to orient our messaging about why it is so important that healthcare workers get vaccinated, even as we're going into, downtrends in overall cases throughout the country and in Oregon. By providing services and supportive care to those who are or might be infected with a virus that causes COVID-19, these healthcare providers are at increased risk of potential infection. But the COVID-19 vaccines have been shown to be highly effective, specifically in healthcare workers. And that's despite this potential for an increased risk of exposure. So specifically, vaccinated healthcare workers were 90% less likely to be infected with the virus that causes COVID-19, and 94% were less likely to develop symptoms of COVID-19. So this really, vaccines remain our best tool to protect our healthcare workforce as well as to reduce spread in these settings.
Thanks, Rachel. Another follow-up question from Wright Gazaway with KATU. Go ahead, Wright.
If I were putting a loved one in one of these care facilities, I would personally want to know the vaccination status of people working there. Is that required for these facilities to share that information with people who are looking to move in? And should it be, if not?
Yeah, I don't know that it's specifically required once asked, but on our end, as we're receiving this information, analyzing and getting it out there, we do think communicating and publishing facility-specific rates is important, not just for consumers, but also for facilities to see where they stand overall in the state. So I do think that's an important feature.
Thanks, Wright. So we currently have no other reporters in the queue. We'll just give it a minute. If you do have any follow-up questions, please submit them to the chat. Dr. Pierce would be happy to answer. Just wait a moment. So. Okay, we have another follow-up question from Rachel Monahan with Climate Week. Go ahead, Rachel.
Hi again. So I'm a little confused. Could these facilities require their staff to be vaccinated?
So speaking generally to all workplaces in Oregon, most workplaces can require COVID-19 vaccine, but I would note that some types of workers are exempt from this. So exempt workers include people that are licensed or certified to provide healthcare, employees of a healthcare facility, and a number of other categories to which I'll refer you to 433 ORS 433.416. So I think a lot of the efforts that we're going to see in these healthcare settings are going to involve conversations about vaccine incentive, public messaging, education.
Thank you, Rachel.
Has OHA?
Oh, go ahead. Sorry.
Oh, has OHA asked the legislature to change that rule? I mean, you've basically said that you've acknowledged that staff. I mean, this is a well-known fact at this point. Is staff come in and infect residents if they're not vaccinated, and there's even breakthrough cases among elderly and vulnerable populations who would be in these settings even if they themselves are vaccinated. Why on earth would we exempt those people and not lower risk employees?
Well, I won't attempt to speak for the legislature or anyone else.
I'm asking OHA though. Like, have you pointed this out to anyone at at the legislature that this is a problem in this environment?
Well, I think when it relates to vaccine mandates, I'm not aware of any immediate plans to, issue rule or issue vaccine mandates broadly for healthcare. But I think there's going to be a continued focus on mandates as we go forward, and we're going to continue to evaluate the role they could play, acknowledging that, they are potentially one tool in the toolbox. But I do think, there are other things that we can focus on in the immediate term that can continue to allow healthcare workers in particular to make an informed choice about vaccination.
Thanks, Rachel. Next question is from Angelina Dixon with KBAL 13. Go ahead, Angelina.
Hi, Becca. Just quick question. So with some long-term care staff that are exempt from getting a vaccination, what happens to them? Like, how are they able to, safely, obviously wear a mask, but how else are they safely able to take care of patients knowing that they're unvaccinated?
Yeah, so, vaccination is our #1 tool to prevent introduction and spread of COVID-19, but there are reliable kind of go-to infection control procedures that everyone should be using in healthcare right now. So masking is still in place in these settings. You know, physical distancing when it's possible, you know, in the context of the provision of healthcare, as well as kind of, you know, the basic PPE strategies we use to reduce exposure risks in healthcare worker populations. So all of those basics are kind of tried and true infection control. Those do remain in place and will continue to do so to protect staff and residents. These vaccines are tremendously effective, but nothing is foolproof. So we want to make sure that, you know, the basic kind of infection control 101 procedures continue to be practiced at a really high level in all of our healthcare settings.
Okay, thank you.
Thanks, Angelina. Those are all the questions we have in the queue right now. So at this point, we'll go ahead and just ask if you have any follow-up questions, go ahead and submit them to the COVID media mailbox. Again, that is orcovid19.media@dhsoha.state.or.us, and we'll work to respond. Also, we will have a YouTube recording of this Zoom meeting, and we will get that posted so you can see it later. And so with that, just want to thank Dr. Pierce and for all her information. And again, let us know if you have any follow-up questions. And thanks for joining us, and have a great rest of the day.
Thank you.
Looks like we are clear.